We begin tonight with our struggling healthcare system. The province unveiled its plan to stabilize the system and keep hospitals open.
And part of the plan calls for patients in hospital who are waiting for a bed in long-term care to be placed in any long-term care facility with room while they wait for a spot to open up at their preferred long-term care home. And that has advocates and some families outraged. Matt Ingram is following the story for us and joins us live with more. Matt?
Phil, lots of people are upset about this proposed legislation. Advocates telling me that they think this plan means that some seniors will be moved without their consent to facilities that they just frankly don't want to go to in communities far away from their home.
The plan to stay open will ensure that Ontarians continue to have access to the health care they need and deserve. And long-term care plays a critical role in our plan.
It's a plan to use long-term care facility beds to free up 2,400 hospital beds, but it's not being received very well.
Are you joking me with this? How is this an appropriate solution? It isn't. It will hurt these residents.
It's appalling. It's a violation of their fundamental human rights and the right to consent.
So what they want to do is to force frail elderly people into any bed that is available.
It doesn't make sense to me that they would disregard the decision of the family members who are caring for these people.
Under the Ford government plan, hospital patients who don't need to be there but are waiting for a long-term care bed will be placed in any long-term care home with space while they wait for a spot to open up at their preferred facility.
There is a challenge in acute care, and long-term care is in a position to make a difference for the first time in generations.
Calandra says investments in long-term care means the industry is in a position to accommodate the influx, but advocates do not agree.
You have the nerve to say that they are in a position when the sector is on fire and flailing, even worse than acute care.
Long-term care expert Vivian Stamatopoulos says crippling staffing shortages and nearly 200 ongoing COVID-19 outbreaks means the industry can't take the added pressure. Stamatopoulos also says the temporary move will become permanent for many seniors because of how difficult it would be for them to move again. She says that means many will end up in substandard places because those are the only facilities that have any room.
So what you are effectively doing is forcing families against their will into some of the worst homes that have the worst outcomes.
We have capacity because people don't want to go to those homes.
Natalie Mera from the Ontario Health Coalition calls it a human rights violation and thinks it's more about filling available for-profit LTC beds rather than fixing health care.
They don't get their full funding unless their beds are 98% full.
The plan worries people like Lizette Sayes from Hamilton, whose father is waiting for a long-term care bed and relies on daily visits from her mother to help with his care. She wonders what would happen if he's sent far away.
We would have to set up a temporary living situation potentially if it was really far away and she can't just commute every day. I have no idea how we would manage that, honestly.
The government is still figuring out how to decide which patients will be sent where.
We're going to be consulting with agencies and our frontline partners on a consistent placement guideline that will ensure patients continue to stay close to their partner, spouse, loved ones, and friends.
Paul Calandra says that no one will be forced to leave hospital without their consent, but how exactly that will be possible given what the plan is very unclear. LTC Association Advantage Ontario says that seniors must not be treated as an afterthought.